Hello, my name is Rachel Hecker, and today I'm going to demonstrate a complete med pass for a person getting medications at a MAP home. And I'm going to be administering Tanisha Johnson her evening meds on 3/3 year. Now I have my medication book, my count book. I have the medications locked up that are controlled substances. I have my med cup, and I have a cup of water. So it is assumed that I already am on shift. When I came on shift, I did a 2-person count. Therefore, I know that the count was correct at the time when my shift started. Okay. So we're going to get started. First, I'm going to wash my hands. I'm going to make sure that the area is clean. I'm going to first look in the medication record. And I'm looking for Tanisha Johnson because she's the only person that's going to be receiving medications. That's David Cook, Juanita. Here's Tanisha. So it's evening time. And so I'm looking for the evening times on the column for hour. So there's 8 a.m., 4 p.m., and 8 p.m. So the only evening med is the 8 p.m. medication. And so I know I'm going to be giving her phenobarbital. So now I can unlock my medication area. And I'm going to pull out all of the medication, and I'm looking for Tanisha Johnson's medications. So that is for Tanisha. I'm putting the ones that are not back into the container. That's David. I'm going to put that back. That's Juanita. So I have these 2 medications for Tanisha Johnson, and I've identified that I'm administering phenobarbital. So this is the one I'm going to keep out. I need to confirm that there's a healthcare provider order before I do anything. I cannot administer medication without a healthcare provider order. So when I go to her order sheet, I see her name at the top here, and I don't see phenobarbital, but I know that the brand name is Luminol. So here it is, Luminol, 64.8 milligrams by ml daily in the evening. Perfect. So I've confirmed that there's a healthcare provider order. Now I'm going to do my first check. The first check has 2 parts to it. First, I'm checking the pharmacy label, and then I'm checking that it matches the medication sheet. So you need to point for your exam. Tanisha Johnson, phenobarbital, 32.4 milligrams, IC luminol. Take 2 tablets, once daily in the evening by mouth. Now, when you go to the med sheet, you also need to check all of the 5 rights, which include the name. So very important to check that name, Tanisha Johnson. Yes. Phenobarbital, brand Luminol, strength 32.4 milligrams. The dose is 64.8. Amount 2 tabs, root by mouth. Daily in the evening. Good. So those match. And now I'm ready to prepare my medication. So ensure that you have control of the medication. Put the med cup underneath the blister that you're popping and pop it right in there. Now I need 2 tablets. So I have 2 tablets in the cup. Now I'm going to do my second check before I can administer the medication. Now I'm going to read through the pharmacy label again. Tanisha Johnson, phenobarbital, 32.4 milligrams, IC luminol. Take 2 tablets once daily in the evening by mouth. Again to the med sheet. Tanisha Johnson, phenobarbital, brand luminol, strength 32.4 milligrams, dose is 64.8 milligrams. Amount is 2 tabs. Root by mouth. Daily in the evening. Good. So that matches. Now I may administer the medication to Tanisha, and I'm going to give her a glass of water as well. So here you go, Tanisha, your 2 tablets and your water. And I'm going to observe for a swallow, make sure she takes her medication. And now I'm going to do a silent look back. And it is silent. You don't need to say anything out loud. I'm just going to double check and make sure everything looks good. And that I'm signing in the appropriate box. Make sure you're signing off on the medication that you gave. 8 p.m. on the 3rd. And I'm putting my initials in there. Now I've already signed the signature box, so I don't need to do that again. And now I've documented that I've administered the medication, but this is a controlled substance. So I'm going to open up my countable controlled substance book, and I'm looking for Tanisha Johnson phenobarbital. So I see Tanisha Johnson phenobarbital on page 4. So I'm just going to glance and ensure that this is the correct medication that I am signing out. Yes, it is. So 3/3 year, and it's 8 p.m. The root is mouth. You can write mouth or oral, either or. There was 18 tablets. I used TWO, and now there is 16. Sign your name legibly. Print if you have to. And so now the count is correct at 16. Very good. I'm going to lock my medication back up. I'm going to close my books. I've documented everything. My box is locked, and I'm going to now wash my hands and observe, make sure the person isn't experiencing any side effects or any ill effects from the medication that they've taken. My med pass is now complete. Thank you.